very good day, everyone. We are UiTM Pharmacy student from Group C of RX70 batch. Today, we are discussing an interesting topic, which is medication reminder technology. Before that, have you ever seen this problem?
Its 2022 Digital News Report, TV3 News was ranked number 1 by 53% of survey respondents for weekly usage in the television,
Mama?
radio, and print category. Also in the top 5,
Yeah? Why your pill box still full? It's already half of the month. It shouldn't be this full. Oh yeah, really? I think I have taken my medicine. Really? What about today? Oh yeah, today okay lah. Actually today I forgot to take my medicine because there's nothing to remind me. Hey mama, next time don't be like this, okay? This medication is very important for you. Okay my daughter, thank you for reminding me.
Based on this situation, we can see that managing medication, including remembering when and how to take them, can be very challenging, especially for those juggling around with many responsibilities and activities. Forgetting to take your medication as right that can have negative and even life-threatening consequences. Fortunately, an innovative technology called medication reminder technology offers a simple solution to help you remember to take your medications on schedule. What if you and your loved one have more than one medication to take? Medication reminder may be a great way to help you stay organized and remind yourself when it is time to take your medications. This will ensure that you and your loved one is taking properly medication and can help avoid unnecessary risks and serious illnesses. For your information, low drug compliance contribute to treatment failure rate up to 50%. Technology-based medicine reminders are starting to appear in the world community and is expected to be a solution to the problem of drug non-compliance. A study stated that the use of medication reminder technology is expected to give a positive impact on medication adherence. Thus, this technology is needed to deal with patients returning home with drugs to minimize therapeutic failure due to drug non-compliance by automatically generating or sending reminders without personal human contact between the healthcare provider and the patient. It is beneficial to the patient for self-care setting. In Malaysia, there is no medication device that is supported by Malaysia's leading healthcare association. However, Institut Jantung Negara (IJN) has utilized digital tools such as Care apps, which allow remote monitoring from family members and caregivers. Currently, adoption of automatic text messaging reminder has been implemented to improve clinical outcomes and modify health behavior. In terms of medication adherence, text messaging is confirmed to improve medication adherence among patients suffering from asthma, AIDS, type 1 and type 2 diabetes mellitus, as well as acute coronary syndrome. However, the only concern of the automated text messaging intervention is the cost involved in developing and maintaining the system. To make a comparison between other countries, Canada, for example, MyMedRec is an app that was designed by Canada's leading healthcare association as a safe and smart way to help you get the most out of your medicines. It is a portable, up-to-date health record that you can easily share with your family and healthcare provider. It keeps track of the medicines that you or your family members are taking and many others elements related to your health. With MyMedRec, all your important health information is saved in one easily accessible place. Even though most Malaysians are not familiar with medication reminder devices or apps, I believe that they have a positive attitude towards this technology. As medication reminder technology is still at its infancy in Malaysia, there is a potential to further develop in this technology as an innovative solution to manage population health besides solving adherence issues to medication. A successful story from the United States where patients who previously only had a 30 to 40% of adherence to medication reached up to 80% through the ease of managing their treatment plans with the help of apps. Thus, from this evidence, I believe that we can similarly improve patient outcome here in Malaysia. With added localization features that are better suited to the local culture and norms. Now, let's apply to this makcik.
Assalamualaikum and good morning, Makcik Fatimah. Good morning. So, how are you today? Good. Okay, I am Musna, your pharmacist in charge for your counselling session today. So, I will counsel you about our new technology, which is MapMinder. This is an electronic pill box. So, are you ready for the session?
Yeah, sure.
Okay, Makcik. This is MapMinder, an electronic pill box that can remind you when to take your medication. So you don't have to worry when you forget to take your medication, because MapMinder is here to save you.
Sound interesting. Wow. What is it?
MapMinder.
So how do I know that this MapMinder could remind me?
Okay, well, this MapMinder is very smart. This pill box can send you notification through light. Okay, let me show it. Through light,
Okay.
sound,
Interesting.
okay, you can hear it, right?
Yes.
And also phone call with its own cellular connection, which means it doesn't need to be linked to a phone line or the internet. Oh, yeah, before that, I need to know how many medication do you take in a day?
Actually, I take 4 medications a day. There's 2 medications that I need to take once a day. And the other one, is it called
Metformin.
Yeah, that medication is 2 times a day, and the other one is 4 times a day. But I don't remember the name.
It's okay. So just to inform you, MapMinder can hold up to 4 daily doses. Also, MapMinder has certain features that can make it ideal for your caregiver, like your children who are currently managing your medication schedule. So your caregiver also will receive notification through email, text alert, or even phone call if you miss the dose.
Okay.
So I want to ask Makcik Fatimah, who currently managing your medication schedule?
My daughter Nurul, she's really concerned about my medication. So I think she will love this technology, and maybe she can set up it for me.
Yeah, that's good. Okay, by the way, MapMinder has individual pill compartment that can be locked until that medication need to be taken. So that setting can help you, or basically prevent you from taking wrong medication. So far so good.
Yeah. So actually, how to use this?
Okay, you don't have to worry about that, because everything will be done by your pharmacist. Firstly, your pharmacist will fill in your medication into this MapMinder, and then they will send it to your house, and you can enjoy using this MapMinder.
Oh, interesting. So I don't need to think anything.
Yes.
But how when this medication is already finished, how I want to refill it?
Oh, about the refilling medication, you just can come to the pharmacist to the pharmacy, and then the pharmacist will settle it for you.
Wow, actually it's really good because I already forgot to take my medication. So this really helped me, I am sure.
Yeah, that's why we introduced MapMinder to you.
Okay, thank you.
Okay.
Wow, I forgot to take my medication. Okay, this one. What need? Water. Okay, done.
Now, we already know the application of medication reminder technology. So, let's take a look at the positive and negative sides of this technology. Firstly, it can improve patient compliance towards medications. As we all know, elderly tend to receive long prescriptions with 4 to 5 medications. This will somehow make them confused and take wrong medications at the wrong time. But with the invention of this medication reminder technology, patients can comply towards their medications, as this technology is able to notify a person when to take specific medications. Apart from that, this technology can contribute to a better health outcome, as certain apps have features to track health measurements for various medical conditions such as weight, blood pressure, and blood glucose level. Thus, it helps patients to always monitor their status of health. Finally, this technology can secure patient safety. This is because some applications can include instructions and information on side effects of each medication, along with drug interaction warnings. However, this technology also has its downsides as well. First, it can increase medication error. Mistakes could happen when a patient puts wrong information in a machine, leading to incorrect drug reminders. As a result, patients receive wrong medication and might induce adverse events or even harm them. Next, this technology is not an elderly friendly. This is because some elderly might not be an IT literate and having difficulty to understand how this technology works. Last but not least, cost also becomes a challenge, as medication reminders are costly for their maintenance and system updates. This will increase burden to patients and also toward the healthcare sector. In short, technological improvements have greatly improved healthcare and provided new ways to practice medicine. But it cannot be denied that technology also has limitations.
Let's move on to the next part. In terms of futuristic technology innovations, we have a few recommendations in improving the features of medication technology for future use. Firstly, the reminder device should be equipped with an alarm that can be set up hourly. The alarm should be made with unique ringtones that can be chosen by the patient. At the same time, vibration and snooze features should be made available until the patient takes the medicine. Secondly, there should be a small screen displaying the time elapsed since the last dose and number of doses taken to help the patient know when he last took the medication. Next, the reminder device should have its own emergency call center. Patient can connect with personnel by pressing a button on the device if he needs immediate medical assistance. It should be equipped with its own cellular connection, which means it doesn't need to be linked to a phone line or the internet. Furthermore, it is recommended to have an app that can be synced with the caregiver's mobile, in which the caregiver will also receive an email, text alert, or phone call if a dose is missed. Next, the reminder device should also come with pill compartments that are locked until timing and medication are correct to be taken. This acts as a safety feature and prevents patients from taking the wrong medication at the wrong time. Lastly, it is best if the reminder device can respond to voice commands. Moving on to the last part, which is the impact of the medication reminder technology in the healthcare. Medication reminder technology is used to solve the problems of poor adherence to the medication regimens that occurs all around the world. A study shows in Malaysia, approximately 46% to 56% of the patients with the hypertension were non-adherents in terms of their medication. Poor adherence causes approximately 33% to 69% of the medication-related hospitalization and accounts for 100 billion in annual healthcare costs. Adherence is the fundamental link between intent and the outcome of the medical care. For instance, it can help to achieve better health outcomes for the patients and reduce the adverse health incidents. It is also reduce the healthcare expenditure by preventing from the unnecessary pharmacologic and diagnostic interventions. Improving medication adherence can result in fewer hospitalizations, rehospitalization, and nursing home admissions. Then, it is convenient, especially for a healthcare provider, to assess the medication adherence. RemindMe and MyMeds are the examples of the devices that have the capability to track taken and missed dose and export the data to the healthcare professionals for the review. These feature medication databases enable the patients or the provider to save times and improve the accuracy when entering the regimens. That's all from us. Thank you.
These are the references that we use in our video.